we come across a lot of anxiety disorders and its types, and it basically includes the generalized anxiety disorders ranging from the panic disorders, the panic attacks, and then there can be agoraphobias in which the person has phobia towards the closed spaces, and then the person can suffer from a lot of distinguished phobias from other objects as well. So all of these different types of anxiety disorders that we usually come across, we should know how to deal with them differently. And once we have diagnosed a typical case of anxiety disorder, what management lines we have to follow. So in this section, we are focusing on the very common type or very common variant of anxiety disorder, which is known as the generalized anxiety disorder, and it's abbreviated as GAD clinically. So this is what we are going to discuss over here, and it's quite problematic in these individuals. The day-to-day, the everyday life is basically affected in such individuals. These people cannot function properly, and so they basically needs a lot of intervention. It can relate to the counseling as well as it can range to the medical intervention as well. So the causes and the clinical features of such a condition termed as generalized anxiety disorder, we'll be discussing it over here. When you come across a patient of GAD, how can you diagnose that these are the clinical features, these are the signs and symptoms that you'd come across in this particular individual, and how can you distinguish such a patient from the other variants of the anxiety disorder? Then the diagnosis, it's again very important, and we'll be discussing what are the guidelines that we have to focus on whenever we are diagnosing a case of GAD. And then we'll also discuss the management lines. So when we talk about the management, is basically starts when the person walks in the outpatient department and you start taking the history. It basically starts from the history taking. So the complete and the explanatory history taking is again very important whenever we are dealing with a psychiatric patient. We'll be focusing on the different values, on the different aspects of his life. It will be ranging from his personal history, the drug-related history, his past surgical and medical intervention history, as well as a corroborative history is taken along with the history which is taken from the patient, and then we'll decide whether the person is suffering from this generalized anxiety disorder or not. So the generalized anxiety disorder is basically defined as it's basically a persistent occurring or on more days than not more than 6 months, free-floating anxiety with at least 4 associated features. So it's basically a free-floating anxiety, and it is not bounded with a certain kind of a condition as seen in the agoraphobias, and it's basically out of the context. The person would not be able to explain the scenarios in context with the surroundings or with the environment, and with at least 4 associated features of the anxiety disorder. It can be physical and it can be psychological as well. So the person will give you a history of palpitations and sweating. He would get the tachycardia, he would sweat, he'll get the dry mouth, and there will be a difficulty in breathing as well observed by the person himself. The feelings of choking, the retrosternal constriction that we were talking about is basically how a layman will define this retrosternal constriction as the choking phenomena. Then the person will also complain of the chest pain, the nausea, the dizziness, and the derealization of the circumstances that are surrounding him. The depersonalization will also be observed by the person, and there'll be fear of losing control or dying as well. So all of these will be included as the symptoms of the GAD or the generalized anxiety disorder. Then the person will also experience hot flushes or cold chills along with it, and the numbness or restlessness will also be experienced by the same individual. The difficulty swallowing, or there'll be irritability, difficulty. So you note basically there's a difficulty in swallowing, there is a difficulty in breathing, and the person is very irritable. there'll be poor concentration in this particular individual, and then there'll be a disturbed sleep pattern. Early rise or the middle insomnia will be observed by this particular individual. If he's aroused, he wouldn't go to sleep very quickly or very easily. So this is the history. This is a typical history that the person would give you. There is an increased muscle tension also observed in this particular individual, in this particular kind of generalized anxiety disorder that we are talking about right here. Then the diagnosis again is very important. It's basically a free-floating anxiety. It's generalized and persistent, and is common in the younger age groups. Especially the females suffer in old age from this kind of anxiety, and mainly it is mild. The illness course is quite chronic and is on a long pattern, and usually when you will get the complete history from that particular person, you'll find that the personality was always borderline in these individuals. There'll be a distinct form of the panic disorders, and the onset is usually in the early childhood. Now, the management of GAD basically relies upon the levels of the social disability and the maladaptive coping strategies. So sometimes when you suffer from these panic disorders, these individuals will usually cope with these panic disorders, and they'll perform normally in their day-to-day life. But when they are maladaptive to these coping strategies, then is the time when you need the medical intervention. The pharmacological interventions are again very important over here. They are rarely appropriate, and they include simple reassurance sometimes, counseling and problem solving. It's sometimes that they all just need. Cognitive behavioral therapy should be considered in these individuals, and a part of this CBT is basically the counseling therapy. But sometimes along with this counseling, you need the medical interventions as well. Then the anxiety management basically includes sometimes all of this. You have to reassure the patient, as well as you have to give him the problem solving. When you get panic, what you have to do. This is basically the problem solving technique. Then the CBT, that basically includes the medical interventions along with the counseling sessions. Now, it can be more severe or it can be more chronic in some individuals, and then the referral to the mental health services is sometimes needed. Sometimes, as a clinician, you cannot treat or reassure such a person, and you would need the higher expertise as well. So the combined treatment is considered, that is basically the counseling sessions along with the medical interventions or the pharmacological therapies or the pharmacological treatments that are available for this anxiety disorders. Pharmacological and psychological beta blockers are the drug of choice over here whenever we are talking about these anxiety disorders that will basically control the palpitations and the sweating in a particular individual. For somatic anxiety, tachycardia, sweating, and tremors, we are going to consider these beta blockers, and they're going to basically control the anxiety symptomatically in a particular individual. So basically, the other management options, they include the serotonin reuptake inhibitors as antidepressants, tricyclic antidepressants. Benzodiazepines are usually avoided in such individuals. Buspirone is less effective in such individuals suffering from GAD. So in this section, we summarized a variant which is very commonly seen, that is referring to the anxiety disorders known as the generalized anxiety disorder. So that is the end of this section. Thank you for watching sqadia.com.